Welcome to Yankee Chronicle. I'm Elizabeth D'Orazio, coming to you right here from New London Hospital, the area's fixture for primary care, emergency services, and the place we always call when we know our kids get sick and we need help. I'm joined by Dr. Lauren Geddes Wirth, who is not only someone who you see here every day as the chief medical officer, but she's also been the interim president for the last 6 months. So this poor woman doesn't sleep, but she's giving it her all to make sure that New London Hospital progresses to give us what we need for our family and friends. So could you tell me a little bit about how the transition has been for you from going from that medical officer job to interim CEO, because that's two very different hats, Lauren.
Yeah, so I started at New London last September as the chief medical officer, and then it was actually in April when I started as the interim CEO. And I have to say the transition actually was fairly easy because, first of all, Tom Mannion was wonderful in helping me with that, but the senior leadership team here is just incredible. You know, they're dedicated to the communities that we have. Their strategic thinking is wonderful. And here it was easy to come. I always say I came home to this area. My husband grew up in Newport. Okay. We both went to school here. We have had a place up here probably for about 15 years. I always say so we could be near his family, but not necessarily with his family. And so our kids learned how to ski at Sunapee, have hiked the Upper Valley. It's just been wonderful to come back.
And it's a slightly different role. Can you kind of tell us what the characteristics of each of those roles are so we can understand your contribution?
Sure. So Chief Medical Officer is kind of oversees anything medical. So we have 2 ambulatory clinics, one here at New London and at Newport. We have a very busy emergency room and express care, our type B emergency room. And so really anything that's medical falls under the chief medical officer policies, the physicians, not the nurses and the other staff. We have a chief nursing officer who's wonderful with that. Again, we have a 25-bed critical access hospital here. Under the CEO is the chief medical officer, the chief nursing officer, the chief operating officer, finance, human resources, communications, marketing. It all falls under the chief executive officer. And so it is really letting your team do the work that they're wonderful at and just helping kind of bring it all together under the strategy for New London Hospital to take the best care we can of our communities.
One of those challenges is the ongoing stress on primary care, people moving to the area, having different needs. When we talked to Tom Mannion last year, he explained that there was a need to adapt to these challenging needs. But I understand that with you and your team that strides have been made to make primary care more accessible, maybe open up more slots because it was full at one time. Can you kind of tell us where that's moved at this point?
Yes, so I'm excited to talk about this because we are almost fully staffed in primary care at both New London and at Newport. So we've brought on a bunch of providers, both physicians and APPs. In doing that, we've done some reorganization. So at New London, for example, they've decided to go into 5 different teams, each with a different theme. So it's pediatrics and senior care, osteopathic family care, lifestyle medicine, and generational medicine. And the communities will be learning more about each of those teams in the next few months. At Newport, they've split into 2 primary care teams. And the whole premise there was to really improve the continuity of care that we give our patients. So when you call, ideally, you'll get to see your provider. But if your provider is not available that day, then you will see another team member. So the teams will really get to know the patients. And that's the best way to take high quality care of our communities.
One of the best things, my family's in the Dartmouth care system, is I always know my nurses and doctors are always talking to each other. So in the event like someone is busy, I always get the same member of the team. And it's been incredible because they've been with my family since my kids were little. One of the other challenges you've had to deal with is that you shut down surgical services, but this was done on purpose to include some upgrades. Can you kind of tell us how you're bringing those surgical services into the forefront?
Yeah, so it's actually exciting. So we are, the ORs have been shut down since the middle of June. We'll actually open up at the end of this month. We are replacing something called the air handler system. So our air handler was about 20 years old. The new air handler is much larger. It'll actually sit up on the roof, so it'll be much more easily accessible if we need to make repairs. but the standards of air exchange in ORs has changed in 20 years, as you might imagine. This unit not only takes us to those standards, but will take us beyond that. And surgical services has increased here. So we have a vibrant orthopedic, Dartmouth Health orthopedic service here, as well as urology and neurosurgery. We just brought on another general surgeon last fall, and we're excited to get those ORs back up and running again and taking care of our communities.
I'm going to say, with all the hats you wear and everything happening, I bet you don't get a moment's rest.
Busy days.
But we very much appreciate it. So I'd like to thank you, Dr. Wirth, and everyone here at New London Hospital for continuing to expand the quality of care we receive for our family and friends.
Stay with us after these messages as we get to meet another New Hampshire craftsman, Annie Fry, who will be showing at the fair August 3rd through 11th. But first, these words from a community-minded business that underwrites our stories. You could be one too by contacting us at ycnnow.com.